everyone, this lesson will learn the normal anatomy of the orbit. The orbit is composed of the bony orbit and the orbital contents. In the adult, the bony orbit is roughly pyramidal in shape. Its volume in the average individual is approximately 30 ml. The anterior entrance of the orbit forms a rough rectangle measuring approximately 40 mm wide by 35 mm high. The orbit attains its widest dimensions at about 15 mm behind the bony rim. The overall dimensions of the orbit are quite variable, especially its depth is about 40 to 50 mm. The orbital cavity is schematically represented as a pyramid of 4 walls that converge posteriorly. The medial walls of the right and left orbit are parallel and are separated by the nose. In each orbit, the lateral and medial walls form an angle of 45 degrees, which results in a right angle between the two lateral walls. The roof of the orbit is composed principally of the orbital plate of the frontal bone. The lamar gland is located in the larimal fossa, in the anterior lateral aspect of the roof. Posteriorly, the lateral wing of the spinal bone containing the optic canal completes the roof. The lateral wall is separated from the roof by the superior orbital fissure, which divides the lateral from the greater wing of the spontaneous bone. The anterior portion of the lateral wall is formed by the orbital surface of the zygomatic bone. This is the strongest part of the bony orbit. Suspensory ligaments, the lateral palpebral tendon, and check ligaments have connective tissues attachments to the lateral orbital tubular. The orbital floor is separated from the lateral wall by the inferior orbital fissure. The orbital plate of the maximal forms the larger central area of the floor and is the region where blowout fractures most frequently occur. The frontal process of the maxillomediate and the zygomatic bone laterally complete the inferior orbital rim. The orbital process of the platen bone forms a small tubular area in the posterior floor. The boundaries of the medial wall are less distinct. The ethmoid bone is paper-thin, but thickness anteriorly as it meets the lamellum bone. The body of the spines forms the most posterior aspect of the medial wall, and the angular process of the frontal bone forms the upper part of the posterior lamellar chest. The lower portion of the posterior lamellar chest is made up of the lamellar bone. The anterior lamellar chest is easily plated through the lid and is composed of the frontal process of the maxilla. The lamellar groove lies between the two chests and contains the lamellar scale. The orbits are related to the frontal signs above, the maximum signs below, and the ethmoid and sphenoid signs immediately. The thin orbital floor is easily damaged by direct trauma to the globule, resulting in a blowout fracture with herniation of orbital contents into the axilloantrum. Infection within the sphenoid and ethmoid sinus can erode the paper-thin medial wall and involve the contents of the orbit. Defects in the roof may result in visible puncture of the globule transmit from the brain. The apex of the orbit is the entry portal for all nerves and vessels to the eye, and the site of origin of all extraocular muscles, except the inferior oblique. The superior orbital feature lies between the body and the lesser wings of the spondable. The superior ophthalmic vein and the lateral, frontal, and tortular nerves pass through the lateral portion of the features that lies outside the annulus of them. The superior and inferior divisions of the oculomotor nerve and the abundance and nasociliary nerves pass through the medial portion of the feature within an annulus of them. The optic nerve and ophthalmic artery pass through the optic canal, which also lies within the annulus of them. The inferior ophthalmic vein may pass through any part of the superior orbital fissure, including the portion adjacent to the body of the spond that lies inferior to the annulus of them. The inferior ophthalmic vein frequently joins the superior ophthalmic vein before exiting the orbit. There are two features in the orbit: superior orbital feature and inferior orbital feature. In the superior orbital feature, there are 3, 4, 5, 6 coronal nerves and the ophthalmic vein. In the inferior orbital feature, there are 5 coronal nerves and the inferior ophthalmic vein. The volume of the adult orbit is approximately 30 ml, and the eyeball occupies only about 1/5 of the space. Fat and muscle account for the bulk of the remainder. The anterior limit of the orbital cavity is the orbital septum, which acts as a barrier between the eyelids and orbit. In addition, the contents of the orbit also includes arteries, veins, nerves, fascia, ligaments, periosteums, and glands. Okay, that's all for this lesson. Thank you for your attention. See you next time.